still really tired, so. I'm a little tired. I had no coffee this morning. So here. According to the American Nursing Association, retrieved on June 24th from the nursingworld.org, there are 3.1 million registered nurses. Only 2.6 million of the registered nurses are actually employed. And out of that, 62.2% of them are actually working in the hospital. Therefore, the health industry obviously is booming, and infection disease are not declining. So what I'm going to talk about is I feel that Hillcrest should offer their employees uniforms. They should, to keep their employees looking professional, to reduce the cost of cross-contamination, and to keep their loved ones at home safe. This is important because some point in life, either you, your child, or a family member will be in the hospital. You want to make sure that your family member is going to be safe. You wouldn't want someone coming in with a dirty uniform on. Nurses work lots of shifts, so you want to make sure that they're getting clean uniforms each time. Today we're going to look at how the uniform keeps the hospital looking professional, how to reduce the cross-contamination, and decreases the mode of transportation of the disease among patients. So I'm going to begin with why the uniform provides a professional look for the employee. When you go to the doctor, you expect someone to be in a crisp, clean uniform. You don't want somebody who is in a wrinkled shirt. You're trusting your life with them, that you're putting your health into their hands. According to Wainwright, in an article retrieved on June 24th from ehow.com, it states that different colors of uniforms, indicate different areas of the hospital. Also, the uniform also will indicate, you see a doctor and you wouldn't want him just coming in a pair of jeans and jeans and a wrinkled shirt. You want somebody who's going to be in a uniform who has the actual jacket on, that that, because you can tell the difference of the workers of what they have on. According to Wainwright article also, it states that, once again, the different colors and stripes denote the different levels of the nurses. Therefore, employers should provide uniforms to their employees. According to Waters in 2005 Nursing Standards article, titled Malone Demands Improvements in Uniform Supplies and Laundering, nurses should never have to take a soiled uniform back home to their loved ones. Now that you see the impact of the uniform on the public, next I will explain how the uniform helps reduce the risk of cross-contamination among patients. The problem with cross-contamination is if the employee is wearing a soiled uniform, it can be spread easily to the next patient. According to Belkin and Blanchard, in an article from Association of Perioperative Nursing Registered Nurses Journal titled Laundering OR Scrubs at Home, dated in 2008, at least 65% of the nurses came in contact with MRSA, and it spread throughout clothing. One of the things that they said where most of the infection was found was like on the front of the uniform. The other place was on the cuffs of the uniform. So, once again, we want to make sure that uniforms are clean, being taken care of correctly and cleaned correctly. Also stated by Belkin and Blanchard, 95% of the clothes, if they're taken home, are usually washed in cold water. 15% of that will use bleach. And they did a study on it, and out of 100 machines that they tested, 80% of the machines tested positive for bacteria. So once again, if the employers are taking care of that, at least you know that the uniforms are going to get processed and cleaned correctly, and you know that whenever your nurse comes in or your doctor comes in, you know that their uniform has been taken care of and cleaned properly. Therefore, once again, employers should offer a changing area for the employees to change out of their uniform and back into their street clothes before they go into the public. One of the other things is, I don't know how you guys feel, but when you go to eat, or you go, say you go to the grocery store and you see somebody in uniform, you don't know where they've been, you don't know who they've touched. They're leaning over to get fruit or something. That area, once again, is the most contaminated area. You don't know who they came in contact with. It could be getting on your fruits and vegetables once again. Now that you see the effect of the uniform and how it is on the public, how it reduces cross-contamination, lastly, I will tell you how the uniform can keep your loved ones safe. With employers providing uniforms, according to Walters in 2005 Nursing Standard article, demand improvements in uniform supplies and laundering uniforms should never have to be worn outside a healthcare facility. Apart from community workers and the nurses should not have to take a soiled uniform back to their home. According to Blanchard from the Association of the Preoperative Registered Nurse Journal, titled Laundering OR Scrubs at Home, dated in 2008, the National Institute for Occupational Safety and Health Study and Washing Workwear at Home found this practice presents risk for families and communities. There was an article that they had did, and it talked about how, once again, transporting that stuff home. If you're going home in a dirty, a lot of people, they get directly off work, they go pick up their kids, they get home, they got to start dinner, they haven't changed, therefore, their loved ones can come in contact with whatever they've been in contact that day. Also stated by Belkin and Blanchard in the Association of Perioperative Registered Nurse Journal, titled Laundering OR Scrubs at Home, dated in 2008, that using scrub attire as streetwear purposes is threat not only to the patient's health, but also to the public at large. Once again, that goes back into, wearing that scrub, not knowing who they've been in contact with. You're eating in the same area that they are. Say they go out to lunch. Once again, you don't know who they've been around. You don't know what they've got on them. So they're ordering sandwiches, you're eating in the same area. If you sit in the same place that they've been, you're going to, whatever was there, you're obviously going to get it on you as well. Therefore, according to the National Institute of Occupational Health retrieved June 24th from the CDC.gov, training efforts should be emphasized to increase employee and employers' awareness of hazards. So today I have spoken about how uniforms make employees look more professional, how it reduces the risk of cross-contamination, and reduces the risk of infecting our loved ones. Therefore, this is why Hillcrest Healthcare should offer their employees uniforms to keep their employees looking professional, to reduce the risk of cross-contamination among patients, and to keep their loved ones safe. Overall, the uniform defines an individual from everyone else, provides confidence, stability, and protection for both the employee and the patient.